Below are 75 MCQs on the circulatory and lymphatic systems, each with answer one-sentence explanation. Questions are grouped by topic for easy navigation. Number 75 MCQs with answers and one-sentence explanations. A. Structure of blood components 1 to 10. 1. Which component of blood is primarily responsible for oxygen transport? A. Platelets, B. RBCs, C. WBCs, D. Plasma. Answer B. Explanation. RBCs contain hemoglobin which binds and transports oxygen. 2. What is the liquid portion of blood called? A. Serum, B. Plasma, C. Hemolymph. Answer B. Explanation. Plasma is the fluid matrix of blood containing dissolved substances. 3. Which WBC is most abundant in blood? A. Lymphocyte, B. Basophil, C. Neutrophil, D. Eosinophil. Answer C. Explanation. Neutrophils make up about 60 to 70% of circulating leukocytes. 4. Platelets are fragments of which cell? A. Megakaryocyte, B. Monocyte, C. Reticulocyte, D. Stem cell. Answer. Explanation. Platelets bud off from large megakaryocytes in the bone marrow. 5. Which blood component helps in clotting? A. RBC, B. WBC, C. Platelets, D. Plasma proteins. Answer C. Explanation. Platelets aggregate and initiate clot formation. 6 plasma minus clotting factors is known as A. Lymph, B. Serum, chyle, D. Interstitial fluid. Answer B. Explanation. Serum is plasma that lacks fibrinogen after clotting. 7. The protein responsible for osmotic pressure in blood is A. Fibrinogen, B. Hemoglobin, C. Albumin, globulin. Answer C. Explanation. Albumin maintains plasma oncotic pressure. 8. Which WBC produces antibodies? A. Neutrophils, B. Basophils, C. B. Lymphocytes, D. Monocytes. Answer C. Explanation. B cells differentiate into plasma cells that secrete antibodies. 9. Eosinophils primarily respond to A. Viral infections, B. Allergic reactions and parasites, C. Bacterial infections, D. Fungal infections. Answer B. Explanation. Eosinophils are key in allergy and parasitic defense. 10. Which cell type is responsible for phagocytosis and becomes macrophages? A. Lymphocytes, B. Monocytes, C. Basophils, D. Platelets. Answer B. Explanation. Monocytes differentiate into macrophages in tissues. B. Blood vessels, arterial and venous system, 11 to 20. 11. Which vessel carries oxygenated blood from the heart to the body? A. Superior vena cava, B. Pulmonary artery, C. Aorta, D. Pulmonary vein. Answer. Explanation. The aorta distributes oxygen-rich blood systemically. 12. Which vessel has valves? A. Arteries, B. Arterioles, C. Veins, D. Capillaries. Answer. Explanation. Veins use valves to prevent backflow of blood. 13. Which vessel has the highest blood pressure? A. Veins, venules, C. Capillaries, D. Arteries. Answer D. Explanation. Arteries receive blood directly from the heart, creating high pressure. 14. The smallest vessels where exchange occurs are A. Arteries, B. Arterioles, C. Capillaries, D. Venules. Answer C. Explanation. Capillaries allow gas and nutrient exchange. 15. The pulmonary vein carries A. Deoxygenated blood to lungs, B. Oxygenated blood to the heart, C. Deoxygenated blood to the heart, D. Oxygenated blood to lungs. Answer B. Explanation. Pulmonary veins return oxygenated blood from lungs to the left atrium. 16. Thick muscular walls are characteristic of B. Capillaries, C. Arteries, D. Venules. C. Explanation. Arterial walls must withstand high pressure. 17. Which vessel returns blood from the lower body to the heart? A. Superior vena cava, B. Pulmonary artery, C. Inferior vena cava, D. Portal vein. Answer C. Explanation. The inferior vena cava drains blood from the lower extremities. 18. The portal vein transports blood from A. Lungs to heart, B. Heart to liver, C. GI tract to liver, D. Kidney to heart. Explanation. The portal vein carries nutrient-rich blood to the liver. 19. Venous blood from the brain drains into A. Carotid arteries, B. Jugular veins, C. Subclavian arteries, D. Aorta. Answer. Explanation. Jugular veins drain the cranial venous sinuses. 20. Arterioles regulate blood pressure mainly by A. Elastic recoil, B. Vasoconstriction, C. Valve function, D. Filtration. Answer. Explanation. Arterioles change diameter to control resistance and pressure. C. Heart position and associated structures. 21-27. 21. The heart is located in the A. Pleural cavity, B. Abdominal cavity, C. Mediastinum, D. Peritoneal cavity. Answer C. Explanation. The heart sits in the mediastinum between the lungs. 22. The apex of the heart points upward, B. Right, C. Left and downward, D. Straight forward. Answer C. Explanation. The apex is directed left, anterior, and inferior. 23. The heart rests on the A. Diaphragm, B. Liver, C. Stomach, D. Lungs. Answer. Explanation. The diaphragm supports the base of the heart. 24. Which structure lies posterior to the heart? A. Sternum, B. Vertebral column, C. Lungs, trachea. Answer B. Explanation: the heart lies between the sternum and vertebral column. 25. The heart is enclosed by the A. pleura, B. peritoneum, C. pericardium, D. mesentery. Answer explanation: the pericardium is the protective sac around the heart. 26. The sternum lies to the heart. A. posterior, B. anterior, C. lateral, D. superior. B. explanation: the sternum sits directly in front of the heart. 27. The lungs lie to the heart. A. medial, B. lateral, C. anterior, D. posterior. Answer B. Explanation: the lungs flank the heart on both sides. D. Chambers and layers of the heart. 2840. 28. Which chamber receives deoxygenated blood from the body? A. left atrium, B. right atrium, C. right ventricle, D. left ventricle. Answer B. Explanation: the right atrium receives venous blood from the venae cavae. 29. Which chamber pumps blood to the lungs? A. left atrium, B. right atrium, C. right ventricle, D. left ventricle. Answer explanation: the right ventricle pumps blood through the pulmonary artery. 30. Which chamber has the thickest wall? A. left ventricle, B. right atrium, C. left atrium, D. right ventricle. Answer. Explanation: the left ventricle must generate high pressure to supply the body. 31. The innermost layer of the heart is the A. epicardium, B. myocardium, C. endocardium, D. pericardium. Answer C. Explanation: the endocardium lines the chambers and valves. 32. The myocardium is made of A. smooth muscle, B. skeletal muscle, C. cardiac muscle, D. connective tissue. Answer C. Explanation: cardiac muscle is specialized for rhythmic contraction. 33. The outer layer of the heart wall is the A. endocardium, B. myocardium, C. epicardium, D. pericardial sac. Answer C. Explanation: the epicardium forms the external surface. 34. The pericardial cavity contains A. blood, B. lymph, C. serous fluid, D. mucus. C. Explanation: serous fluid reduces friction during heart movement. 35. Atrial walls are thinner than ventricular walls because A. they pump blood farther, B. they receive blood passively, C. they pump under lower pressure, D. they have less oxygen. Answer C. Explanation: ventricles generate more force than atria. 36. The septum separates A. atria from ventricles, B. left and right heart sides, C. pulmonary and systemic circuits, D. arteries and veins. Answer B. Explanation: the septum divides the heart into left and right halves. 37. Trabeculae carneae are found in the A. atria, B. ventricles, C. pericardium, D. coronary arteries. Explanation: these muscular ridges help ventricular contraction. 38. Auricles are extensions of the A. ventricles, B. atria, C. septum, D. aorta. Explanation: auricles increase atrial capacity. 39. The fibrous skeleton of the heart provides A. blood supply, B. electrical insulation, C. hormone secretion, D. immune protection. Answer B. Explanation: it electrically separates atria and ventricles. 40. Which layer is responsible for heart contraction? A. epicardium, B. endocardium, C. myocardium, D. pericardium. Answer C. Explanation: the myocardium contains contractile cardiac muscle. E. heart valves and coronary arteries. 41 to 53. 41. Which valve is between the right atrium and right ventricle? A. mitral, B. aortic, C. pulmonary, D. tricuspid. Answered. Explanation: the tricuspid valve controls flow on the right side. 42. The bicuspid valve is also known as the A. aortic valve, B. pulmonary valve, C. mitral valve, D. tricuspid valve. Answer C. Explanation: the left AV valve is the mitral valve. 43. Semilunar valves include A. mitral and tricuspid, B. aortic and pulmonary, C. mitral and aortic, D. tricuspid and pulmonary. Answer B. Explanation: semilunar valves guard major arteries leaving the heart. 44. The coronary arteries originate from the A. left ventricle, B. right atrium, C. aorta, D. pulmonary artery. Answer C. Explanation: they arise from the aortic sinuses. 45. The right coronary artery primarily supplies the A. left ventricle, B. SA node, C. left atrium, D. aortic valve. Explanation: the RCA often supplies the SA and AV nodes. 46. The left anterior descending artery supplies A. right atrium, B. interventricular septum, C. SA node, D. pulmonary trunk. Answer B. Explanation: the LAD supplies the anterior septum and ventricles. 47. Papillary muscles prevent A. valve opening, B. valve prolapse, C. aortic regurgitation, D. ventricular contraction. Answer B. Explanation: they hold the valve leaflets via chordae tendineae. 48. Coronary sinus drains into the A. left atrium, B. right atrium, C. left ventricle, D. pulmonary trunk. Answer. Explanation: venous return from myocardium enters the right atrium. 49. The aortic valve prevents backflow into the A. left atrium, B. left ventricle, C. right ventricle, D. aorta. Answer B. Explanation: it stops blood from returning to the ventricle. 50. The pulmonary valve prevents backflow into the A. Right atrium, B. Right ventricle, C. Aorta, D. Left ventricle. Explanation: it prevents return from pulmonary artery to right ventricle. 51. Valve closure is caused by A. Electrical impulse, B. Pressure changes, C. Muscle contraction, D. Atrial contraction. Answer B. Explanation: valves respond to pressure gradients. 52. Narrowing of coronary arteries is called A. Endocarditis, B. Stenosis, C. Infarction, D. Myocarditis. Answer B. Explanation: stenosis restricts blood flow. 53. Coronary circulation occurs mainly during A. Systole, B. Diastole, C. Inspiration, D. Expiration. Answer: explanation: coronary perfusion increases when the heart relaxes. F. Nerve and blood supply to heart, 54 to 60. 54. The pacemaker of the heart is the AV node, B. SA node, C. Purkinje fibers, D. Bundle of his. Answer B. Explanation: the SA node initiates the heartbeat. 55. Sympathetic stimulation causes A. Slower HR, B. Faster HR, C. No effect, D. Valve closure. Answer B. Explanation: sympathetic nerves increase heart rate and contractility. 56. Parasympathetic fibers to the heart travel via the A. Vagus nerve, B. Phrenic nerve, C. Glossopharyngeal nerve, D. Accessory nerve. Answer A. Explanation: the vagus nerve slows heart rate. 57. The AV node delays impulses to allow A. Ventricular filling, B. Atrial contraction, C. Valve opening, D. SA node rest. Answer A. Explanation: delay ensures ventricles fill before contraction. 58. Purkinje fibers function to A. Slow conduction, B. Spread impulses rapidly, C. Initiate heartbeat, D. Supply oxygen. Answer B. Explanation: they rapidly transmit impulses across ventricles. 59. The coronary arteries supply A. Lungs, B. Myocardium, C. Brain, D. Liver. Explanation: they nourish the heart muscle. 60. Baroreceptors that regulate HR are found in the aorta and carotid sinus, B. Larynx, C. Pancreas, D. Liver. Answer A. Explanation: these sensors detect blood pressure changes. G. Lymphatic tissue and system, 61-68. 61. Lymph is formed for A. Blood plasma, B. Interstitial fluid, C. Tissue cells, D. Sweat. Answer B. Explanation: lymph originates from excess interstitial fluid. 62. The largest lymphatic organ is the lymph node, B. Tonsil, C. Thymus, D. Spleen. Answer D. Explanation: the spleen filters blood and stores immune cells. 63. Lymph nodes function primarily to A. Warm blood, B. Filter lymph, C. Produce hormones, D. Produce RBCs. Answer B. Explanation: they trap pathogens and activate immune responses. 64. Which structure absorbs dietary fats? A. Peyer's patches, B. Lacteals, C. Spleen, D. Thymus. Answer B. Explanation: lacteals and villi absorb fat-rich chyle. 65. The thoracic duct drains into the A. Right subclavian vein, B. Left subclavian vein, C. Aorta, D. Superior vena cava. Explanation: the thoracic duct empties into the left venous angle. 66. The thymus is essential for maturation of A. B cells, B. T cells, C. RBCs, D. NK cells. Answer B. Explanation: T lymphocytes mature in the thymus. 67. Lymph flows as a result of A. Heart pumping, B. Valves and muscle contraction, C. Gravity only, D. Peristalsis only. Explanation: lymph moves via skeletal muscle and valves. 68. Tonsils provide protection against A. Digestive enzymes, B. Airborne pathogens, C. Hormones, D. UV radiation. Explanation: tonsils trap pathogens entering the respiratory tract. H. Veins used for IV injections, 69 to 72. 69. The most commonly used vein for IV cannulation is the A. Basilic vein, B. Median cubital vein, C. Femoral vein, D. Jugular vein. Answer B. Explanation: the median cubital vein is large and easily accessible. 70. Which vein is often used for emergency IV access? A. Dorsal metacarpal vein, B. Femoral vein, C. Subclavian vein, D. Cephalic vein. Explanation: the femoral vein is accessible in critical situations. 71. A peripheral IV is commonly started in the A. Foot, B. Hand veins, C. Neck veins, D. Abdomen. Answer. Explanation: hand veins are easy to access and visualize. 72. The cephalic vein runs along the A. Inner forearm, B. Outer forearm, C. Lower leg, D. Neck. Explanation: it lies on the lateral side of the forearm. Eye application and implication in nursing to 75. 73. Knowledge of heart anatomy helps nurses identify A. Digestive disorders, B. Referral sources, C. Location for auscultation, D. Dietary needs. Answer. Explanation: proper auscultation requires understanding heart positioning. 74. Understanding veins helps nurses A. Read ECGs, B. Perform IV access safely, C. Prescribe medications, D. Perform surgery. Answer B. Explanation: vein knowledge ensures safe and effective cannulation. 75. Knowledge of lymphatic drainage helps nurses assess A. Blood glucose, B. Fluid balance and infection, C. Bone structure, D. Lung capacity. Answer. Explanation. Lymphatic pathways are crucial for detecting edema and infection. Thank you. Have a nice day.